Namaste and good afternoon from all of us at Apollo Hospitals. We hope you're well, fit, healthy, and fine. This is Dr. Srinidhi Chidambaram welcoming you to our FB Live for today. At Apollo Hospitals, with our motto of touching lives, we place great importance on creating health awareness among people, as we know that prevention of disease and early detection is crucial to better outcomes. Today, we are going to discuss a very important topic, which is comorbidities and heart disease. I don't know how many of you know what comorbidities actually mean, but in medicine, comorbidity means it is the presence of one or more additional conditions, often concomitantly or concurrently, occurring with another primary condition. In other words, a comorbidity is a health condition that exists along with another primary health condition. For example, a person might have diabetes and then develops high cholesterol. High cholesterol can be a comorbidity for diabetes, and there can be 2 or 3 different conditions which also coexist together, one forming a comorbidity for the other. Comorbidities assume a lot of importance when it comes to heart disease, as they can directly impact the severity of prognosis and how outcomes are going to be. Just as an example, if there is high blood glucose from diabetes, it can damage your heart and blood vessels over time, and this damage can lead to heart disease. So when one is having symptoms of heart disease, there is always a question as to whether comorbidities like diabetes are there or not. And it is important for you to know what are your conditions, what kind of diseases do you have, what comorbidities exist. And to explain this to us and for making you understand what comorbidities are and how they particularly affect heart diseases, and more importantly, how you can manage these comorbid conditions and live with them without affecting the heart too adversely, we have with us Dr. Rahul Gupta, who is a senior cardiologist from Apollo Hospitals, Navi Mumbai, to tell us exactly what comorbidities and heart diseases are and how to manage them. Dr. Rahul R. Gupta, MD DM Cardiology, is a consultant cardiologist at Apollo Hospitals, Navi Mumbai. He holds more than 15 years of experience in this field of cardiac sciences, and he has been an expert at handling several complex procedures, such as angioplasty during heart attack, complex angioplasties, use of methodologies like IVUS, FFR, rotablator, pacemaker implantation, ALCR implantation to prevent sudden deaths, cardiac resynchronization therapy for improving heart function, structural heart disease interventions like opening of the stenotic valve with balloons, closing holes in the heart with devices using non-surgical methods, as well as treatment of peripheral vascular diseases and so on. He's one of the few professionals trained in TAVI as well, and has received this training from Dr. Alan Cribier from France and Dr. Giza Fontos in Budapest, Hungary. And he has many firsts to his credit, such as the first to perform leadless pacemaker implantation, first to perform bioabsorbable stent implantation, first to perform MRI-compatible biventricular pacemaker implantation, etc. And also holds several awards and accolades, including the first in MD degree, the Shankar Dayal Sharma Gold Medal, and so on, and the first in DM Cardiology as well, and has also got many publications and research works to his credit. Welcome, Dr. Rahul Gupta. Thank you so much for joining us on this FB Live. And I am now handing this over to you to explain to our viewers exactly how comorbidities can be handled in heart disease.
Thank you, Dr. Srinidhi, for the kind introduction. And I think it's a very important topic, and you have already introduced what comorbidities are. So basically, presence of two simultaneous conditions which may or may not be related in further propagating each other. Now, when we talk about heart and comorbidities, or they are basically multiple factors. So somebody can have diabetes, somebody can have diabetes plus blood pressure plus dyslipidemia, that means high cholesterol. Some people can have additional renal dysfunction. Now, the most important part about these comorbidities are they do not just add, they multiply. Their effects multiply. So therefore, it is very important that we handle every possible comorbidities, because they are finally leading to bad outcomes from all the angles. So somebody who has got blood pressure, diabetes, high cholesterol, renal function, they are at extremely high chances of developing the heart disease. So lesser the comorbidities, lesser are the chances. So the importance of understanding the comorbidities are that their effects are multiplicative. So for example, 4 plus 4 is 8, but when you multiply 4 into 4 is 16. So this is what the comorbidities do in our body. And the difficult part, or the most important part about these comorbidities, most of the comorbidities related to the cardiovascular disease, they are all silent killers. Like for example, hypertension, high blood pressure is called as a silent killer because they don't produce symptoms in majority of the people. Similarly, high sugars will produce symptoms only when the sugars have caused some kind of complications, or very high sugars. Similarly, high cholesterol. So their importance lies in understanding that they are silent killers, and the only way to detect them is to get yourself evaluated regularly, so that you can find out whether you have these comorbidities and then act accordingly. Plus, these comorbidities, they also have, like, it's like a network. So people with hypertension, they have high chances of kidney disease. In turn, the kidney disease will cause resistant hypertension, so increases the chances of having high blood pressure very high. Similarly, those with hypertension will also have higher chances of diabetes, will also increase the chance of kidney disease, will also increase the chances of heart disease. Those patients with heart disease also increases the chances of having a kidney disease. So it's like it's a meshwork network connected to each other, and therefore it becomes very important when we start targeting these comorbidities together. It helps to prevent the progression of the existing illness, also can prevent in those people who still don't have developed the complications, so it can be prevented. So I think this is about the importance of comorbidities. Higher chances of developing hypertension, because and similarly, those that have hypertension, they have higher chances of developing cholesterol, high cholesterol also. So they are basically from the common family. It's a common root hypothesis that all these diseases are emerging from the common root, and therefore they catch up with at one time or the other. Somebody might have hypertension earlier, but they can develop diabetes later on. So this is also very important to understand, that even if a person has one disease condition, they want to prevent the other conditions to creep into their life, and therefore they have to be very proactive about their health. So this is the importance. It's like it's said now, but they flock together, bird of the same feather. So it's like the same kind of common root thing.
I think this word comorbidities has become quite well known among the people, because with the COVID pandemic, people were talking about comorbidities a lot. And there was one particular group which were singled out for vaccines earlier than the others because of comorbidities.
Correct.
So obviously, I think they have an impact in so many ways. But could you now tell us what a person can do? Like, is there something that, proactively can be done? You were mentioning that they need to be proactive about identifying comorbidities. So how can comorbidities be identified?
Yes. So as I told you, the most important part, everybody has to understand that most of these comorbidities related to cardiovascular issues are like silent killers. So the only way to know them, that you have it in you, is to do regular evaluation. So therefore, if you look at the chairman's vision, Dr. Pratap Reddy's vision, that how he has created a proactive health group where health checkups and all, where, because otherwise in this busy life, we feel that unless we have symptoms, why should we go to a doctor? But people fail to understand that there is a very, very long course of asymptomatic phase. So the blood pressure will not cause symptoms for very, very long, until unless there is a complication, people don't have symptoms. So the most important thing is that we go for regular checkups whenever we have the opportunities. There are so many corporates which conduct regular health checkups in the various corporates, and people, whenever they are going for even for basic illnesses like cough and cold, they should get their blood pressure evaluated. As such, BP machines are easily available, they should get evaluated. Similarly, the blood tests have become so common. People can call up the lab, people can come, and there are various health checkup programs which are available. So this is the most important part, that don't wait for the symptoms to occur and then take action, which is our normal psychology, human psychology, that why should we go to a doctor when we don't have any symptoms. So this is very important, to diagnose these comorbidities in the earlier stages and then start acting. Now, as you were saying, what should they do to prevent further progression of these comorbidities as well as other comorbidities coming into our life? Because the studies have shown, as I was telling you earlier, that people with high blood pressure, they have higher chances of developing diabetes. So once a person knows that they have developed high blood pressure, they have to become proactive in detecting these other risk factors on regular basis. So once in a year, I think everybody should go and check them, especially after the age of 40 is for sure. But even if you do at an earlier age, because we are seeing heart disease in a much younger population in our country, so we can be proactive. The international guidelines says that you should have your first checkup related to your blood pressure, cholesterol, your blood sugar at the age of 20, and then every 5 years, and then you after 40 you can do every year. But in India we can change this guidelines, and we can make it little more earlier, because we are seeing heart disease at the earlier age. Now, because they arise from the common root hypothesis, if you start taking proactive action in terms of your diet, exercise, your sleeping habits, which we will discuss in our discussion if we have time, they will have beneficial impact on all these comorbidities. So if you start taking good action like diet and exercise plan, if you are a diabetic, it is going to help you to prevent development of high blood pressure. So this is the importance of identifying early and then regular surveillance to pick them in the early stage and take proactive actions.
And I think it is important that you mentioned here about the health check program, because I think, even though there are many health check options, but I think, the Apollo health check has been carefully designed for various age groups, for also so that the time that you spend is kind of covers a lot of important investigations. It's not just the blood tests. And we also have different types of checks, for example, the Well Woman check and the Pro Health. So I think it's important to also choose an option which actually covers all, as much as
I would agree,
comorbidities that you can find out at the earliest and try to reverse them. So coming to the actual comorbidities, we were talking about hypertension and diabetes. Could you tell us what are the different types of comorbidities that can particularly impact the heart disease, apart from the diabetes and the hypertension? Is there anything else, or what should be the entire list of people of the comorbidities that people should be looking out for?
So I will start enumerating everything, and I am enumerating those comorbidities which can actually be tackled by our own actions. Okay.
Yes,
for example, a family history, you can't do anything about it, but it's a family history is like a loaded gun, but the trigger is with us. This is the, if the gun is loaded, but if you have never triggered, it's never going to fire. So genetics is like loaded gun, but the actual trigger is with us, which is the environmental. So these are the comorbidities which we can actually take care. So hypertension and diabetes, you have already told. I want to take you to little bit early stages of diabetes and high blood pressure, which is often neglected, and this is called as pre-diabetes and pre-hypertension. So pre-diabetes means your sugars are slightly more than normal, but they are not in the diabetic range, so you're not called diabetic. But pre-diabetic itself is a risk factor for so many macrovascular complications, including the blockages in the heart. So it has to be tackled, it has to be taken care of, and it cannot be neglected that it is just the beginning. People take it lightly because they think it is, I'm still not diabetic. So it's just the thought that, if it is this value, then I'm diabetic, I need to take action. If it is not this value. So pre-diabetes is also very important. Similarly, there is a concept of elevated BP, where we are saying, like, for example, the BP less than 120/80 is considered as normal. Now with the 120 to 30, that means it is slightly more than normal. It is called as elevated BP, although there is no recommendation to take medicines in this group. but it should put you in on alert that you need to take action, because now you are in an elevated BP group where if you don't take action now, you're definitely going to need medications in future. Then high cholesterol values, these are something which can be tackled very well through diet, exercise, and we need medications often. Then we have obesity, which is something which is also neglected. There is something called as hidden obesity in the Indian context also, because the Indian hidden obesity is thin obese person. So what is this thin obese person? A person whose weight looks normal, but he has a belly which is coming out, which is called as abdominal paunch, which is coming out. Now, this is a visceral fat, and this comorbidity is neglected quite often. Somebody whose hip waist ratio is not matching, that means the waist is significantly more, and there is abdominal fat which is there, is a significant comorbidity. So there can be obvious obesity where the BMI is very high, and then there is also a hidden obesity which is quite often missed by people. Then there is something which is also very often neglected, and I wish to tell you that people should understand, is something called as obstructive sleep apnea syndrome. Now, people who are sleeping in the night, but they are a loud snorer, or even they are not getting good quality of sleep because of the snoring. So their body is under tremendous stress because they're not getting adequate oxygenation. And this reflects in increasing the chances of insulin resistance, causing diabetes, causing high blood pressure, and also impact renal outcomes. That means the kidney problems can also increase. And I can tell you, a lot of times when there is nothing found, their BP is on the higher side, we don't know why it is happening. You ask them the history of snoring, and they will say, yeah, we snore a lot. I snore a lot. And then you ask that whether they feel sleepy during the day, lazy during the day, less energetic during the day, and they will respond yes. And this is one comorbidity which needs to be tackled. So obesity, hidden obesity, sleep apnea, these are something which are not usually asked by sometimes or not observed, and people think it is a benign. Sometimes they know that they are snoring, but they think it is benign, so it needs evaluation. Similarly, renal dysfunction, there are a lot of cardiorenal syndrome. So heart and kidneys are strongly related. Those people who have kidney disease, they have higher chances of developing cardiovascular diseases like blockages and all those things. So even people who, the early CKD could be just leaking of protein in the urine, which cannot, and the creatinine values will be normal. So those people who are hypertension and diabetic, they should also check whether they are secreting albumin, microalbumin into their urine, and if it is high, that means they have already started to develop kidney disease. And kidney disease, which is chronic kidney disease, can lead to again cardiovascular disease. So these are something which are things which needs to be seen. Now, we had a death of a celebrity, young 40-year celebrity. I don't know whether you are aware, Siddharth Shukla. He had
shocked to see.
It was,
yes.
Yeah, it was a very shocking incident. That's such a healthy. So I have seen a lot of, and in my own case studies, I have realized that lack of sleep and stress, which again cannot be measured, the stress cannot be measured, also impacts and should be considered. Mental stress should also be considered as a comorbidity for heart ailment. So these are certain things which I want to make aware through our talk, that they cannot be neglected, and over a period of time they can create a situation which can affect our health negatively.
So you were talking about stress. Could we talk a little more about that, because that is something which is now surrounding all our lives. There's nobody, even a child has stress. So right. Especially after the pandemic, it's only become more and not less. So what would you suggest? Because this stress is something which can neither be measured, nor there is an exact medicine or a solution for it. And it is a comorbidity for so many conditions, including heart disease. So I just wanted to know, what is your recommendation for people who have go through immense stress or react very anxiously and in a very stressful manner to life events?
Yeah, so I'll tell you, Dr. Srinidhi,
I think that includes myself. We are asking even for myself.
So it's a very important topic, often neglected, because stress is something which we have started feeling that it is part and parcel of our life. I am under stress, he is under stress, she is under stress, everybody is under stress. So we have started considering stress as a normal thing in our lives, okay, which is completely unacceptable. And therefore, we need to, now this is little bit of subjective thing, because for the same situation, a person can feel a tremendous amount of stress and the other person can feel completely cool about it. So stress is the reaction to the external stimuli which our body is giving. So there is an external stimuli or external situation. How are we reacting to it defines our stress. So usually I take a lecture of about 1 hour on just stress management. We will go on to some very basic principle as to define whether you are under stress or not. So whenever you are under a situation, and suppose there is a situation, difficult situation, and you have reacted, now you have to see the emotional health, or you have to answer, are you feeling happy or not about anything? So if you are feeling happy about a situation, that means you are on the right path. If you are not feeling happy, so there can be only two ways you will react to a situation, or two feelings you can have. You can feel good about that situation, or you can feel bad about that situation. So if you're feeling good about that situation, you're feeling happy, which is your internal judgment, then you are on the right track. If you're not feeling happy, sometimes we say, I'm feeling so, I'm okay. That is not. Either you are happy or you're not happy. So if you're not happy, then you start thinking, what are the measures to make yourself out of this? And it is part and parcel of our life, like day and night. After every day there is night, and after every night there is a day. So these happiness and unhappy moments are going to be there. What we have to make sure is that whenever we are unhappy for a very small time, so that it doesn't impact our body, because unhappiness negatively impacts our body by secreting stress hormones, which have their negative impacts. So what I would recommend is, and which I do personally, because we have a very hectic, busy and emergency life, getting up in the night, getting calls in the emergency, is to practice yoga, practice meditation, practice pranayam, deep breathing, because that cleanses your body. And what I suggest to the office goers and those who are again busy, that you can find time. If it is half an hour, 45 minutes, you have been in your office desk, you can just take few deep breaths through your nose, exhale through your mouth without disturbing your colleagues. And it is a good habit. It cleanses. So deep breathing is something which can be done all throughout the day, conscious breathing, which you call, and you will be able to get little bit of, say, 1 hour have passed, just close your eyes, take deep breath, and this can help you. Practicing meditation, practicing yoga, practicing doing exercise releases endorphins, and it can the endorphins are the happy hormones, and it keeps you on a happy note. So whenever there is a external situation, suppose somebody talks to you in a bad language, usually our reaction is that we become upset about it. But those people who are meditating, who are exercising, who are doing all this pranayam and all those things, the impact of these situations is very less on them. So suppose I am in a happy state of mind, I have practiced mindfulness, meditation, I've done yoga, and somebody says a bad word to me, or in a language which I don't like, I will be quite okay with it. I will say the other person itself is in not a good sense, so I will not. But if I'm not done that, if I've not slept well, I may become very much irritable, but it's going to harm me. So you have to find out things which makes you happy. So reading good books, positive thoughts before, after getting up, before sleeping. So there are various ways where we can handle the stress. There is a concept called as SBO concept. So here is a situation and here is an outcome. So this situation will decide the outcome. Outcome can be happy or unhappy. And we always blame the situation, that this is the situation which has caused me the outcome of either happiness or unhappiness. But we forget about this B. And this B is about the belief about this situation. So if you start changing, suppose there was a situation and you became unhappy in that, don't blame that situation, because these situations are not under our control usually, and they can come again and again. So think about what I can think about this situation which will change the outcome to happy outcome. I'll just give you a short example so that people get the idea of what I'm saying. For example, a person enters our room and he starts abusing us. So it is a situation, a person entered my room and abusing. The outcome would be, some people will become really angry, may hit him back, may abuse him back, and most of us will be angry about the situation. So there is a situation and there is an outcome which is very unhappy. Now we find that an old lady comes in and holds the hand of that boy who was giving abusive languages and saying sorry, that he's a mentally retarded person, he doesn't understand what he is saying. Immediately the anger will change into sympathy. The situation is same, but the anger has changed into sympathy, empathy. Those who might have abused him might start feeling bad that he's a poor boy, he didn't understand. So what I'm trying to tell you is the situation was same. The boy coming in, entering, But once we know, or once the belief is changed about that situation, the outcomes have become completely different. So this is just an example. So whenever you face a situation which has made you unhappy, and if you cannot change that situation, cannot change the place where you are working, I think start looking at the belief which you have made, because finally it is your own health which is very important. So these are certain points but
But I
we
think
can.
I think it was important to discuss this, because when we talk about comorbidities, we always forget about the mental health and the stress and the sleep. We only talk about diabetes and hypertension. And so, what about other comorbidities, doctor? Are there other things like, anemia or thyroid disorders or liver disorders or lung disorders? Do they also impact the risk of heart disease?
Yes. So, like for example, a person, I will go one by one and 1 minute each for them. Somebody who develops a lung pneumonia, they can have precipitation of heart disease or heart attacks after the pneumonia. And therefore, now it is recommended that those people who have comorbidities, already heart disease, they should take flu vaccines or pneumococcal vaccines to prevent them to develop these pneumonias, because they precipitate the heart attacks, or even both minor and major, and can accelerate the progress of the disease. So this is how lung, because finally lungs causes the gives the oxygenation. So if the lungs are damaged, it can impact the heart adversely. Similarly, anemia means lack of hemoglobin, lack of blood in the body. So if somebody who already has a heart disease, and if there are blockages, and if the hemoglobin goes down, their symptoms become more pronounced, and they can develop more chances of developing heart failure symptoms or anginal symptoms. That means blockage related symptoms if they have anemia, and that needs to be corrected. Similarly, kidney disease. If they have a kidney disease, as I was telling you earlier, that kidney is those people who have kidney disease, they have higher chances of developing the heart disease. And when they go under treatment for blockages, they have more chances of recurrence also. So therefore, this comorbidity has to be also tackled. Liver will also somehow impact. It's not directly related, but there are certain medications which you cannot give when there is a liver comorbidity and all. So it impacts, but it is less on the list as the other things which we have discussed.
So we'll now take a few questions which have also come from our audience and from people who are watching this live. There is a question about sleep, in the sense that, like we did say that sleep is lack of proper sleep does cause tremendous stress and can affect the heart. But then today we find that there are a lot of people, so they want to know whether is it okay then to take a sleep medication to enable a better sleep, so that you don't have
Yeah, so
the
I will tell you anything. My typical idea of treating somebody, or the is to try first the natural things. Okay, so instead of going directly to the medication, we have to look at the reasons why a person is not getting sleep. So there are two aspects of sleep. One is the quantity of sleep, and the other one is the quality of sleep. So quantity of sleep means we should be sleeping for about 6 to 8 hours. The adult requires a sleep of about 6 to 8 hours. Uh, at least there should be 4 sleep cycle. One sleep cycle is for 1.5 hours, because there is NREM and REM stages of the sleep, and that takes 1.5 hours. So 4 sleep cycle means about 6 hours. So usually 6 hours are needed for completing the 4 sleep cycle. 5 sleep cycles would be much slightly better also, but so therefore 6 to 8 hours is a good sleep time. Now those people who are not getting, so this is about the quantity of sleep. Now to maintain that quantity sleeping, there is a sleep hygiene or sleep discipline which we need to maintain. So those people who are not getting sleep, they should not have caffeinated drinks after 2 p.m, because if they are very sensitive, so at 2 p.m 3 p.m, after that they should not have tea or coffee, because that will reduce the sleep. They should stop seeing the screen, because screen is considered as the white light or sunlight, and it is perceived as the sunlight by the body. And melatonin secretion is very important for induction of the sleep. So people, if they are watching their mobile till the time they want to sleep, or they are watching TV or any gadgets or laptop, the chances of melatonin secretion, adequate medical melatonin secretion will go down, and therefore the induction of sleep and maintenance of sleep will go down. So therefore they have to improve the sleep hygiene. And that the kind of lights which we have in the room and all, warm yellow lights, so those are considered as night lights, while white lights, the tube lights which we get, are considered as. So all these screen lights, as well as those kind of lights, should not be there once 2 hours before the sleep, so that our melatonin starts secretion. And practicing, again, as I told you, there are various ways. A lot of meditations are available. I myself practice Yog Nidra, which helps to induce a good sleep. And this people can follow their own way so that their stress is reduced. If there is a lot of thinking going on in the mind, the chances of you getting a proper sleep is also down. So reading very light literature, not reading too much at one time or becoming very active in the night in terms of work thinking process, will reduce the chances of having a sleep. So this is about some sleep hygiene which has to be there. Similarly, do not drink too much of water before sleep, because otherwise you might have to get up to pass urination, and then that might also disturb the sleep. And then comes the quality of sleep. So somebody might be sleeping for 6 to 8 hours, but they are a heavy snorers, as I was discussing with you. So if they are heavy snorers, their snoring occurs because your muscles are collapsing and causing an obstruction to the airflow. So if the airflow is not happening properly, the oxygenation will not reach, although it appears that the person who is sleeping with snoring is in a deep sleep, but that's not correct. He's not getting adequate oxygenation during the sleep, which is very important for the recovery and of all the damages which we have done throughout the day. So sleep is the repair time, and oxygen is very important molecule for the repair process to be initiated. So if you're the person is not feeling fresh after getting up in the morning, lack of energy is there all throughout the day, they tend to feel little lazy, they tend to doze off if there is nothing else to do. These could be signs of obstructive sleep apnea syndrome, and therefore they should go to a sleep specialist to get it rectified. So these would be my suggestions for sleep thing, and the last resort is to take medications.
The next question is, what is the role of statins in reducing the cholesterol problem?
Yes. So there are many criteria which have been made to initiate the statin therapy. Statin therapy is the most effective therapy for reducing the LDL, the bad cholesterol. So somebody who doesn't have any other comorbidities and has LDL more than 190, they should take the treatment. Even if they have tried good lifestyle and their LDL is not coming down, then they should take the statin. Now, if you look at the Lipid Association of India guidelines, which are the recent guidelines for the Indian people, it has been suggested that despite adequate non-pharmacological therapy, that means diet, exercise for a period of 3 to 6 months, if the LDL remains more than 130, then these patients should be initiated in a small amount of statin. For patients who are diabetic, diabetes is a comorbidity, their LDL is supposed to be less than 70. Okay, so every diabetic whose LDL is more than 70, they should be on the statin to keep it less than 70. Anybody who has been diagnosed with blockages anywhere, either in the brain arteries or the leg arteries or the heart arteries, they need to be on the statins. So statins become important medications for all these group. And somebody whose cardiovascular risk profile is very high, suppose they are at very high risk of developing the heart disease, then again, these are the patients who have to be on the statin to keep the LDL less than 70. The bad cholesterol has to be less than 70 in these high risk group people also. So there are calculators which are available to calculate the risk.
Okay. The last question is about exercise. So there is this, we keep hearing about people who also exercise a lot and then they develop heart attacks. So what is the ideal amount of exercise that one should do, and when does it become too much?
Okay, so I'll tell you first we need to understand that as we eat food, we need variety of foods to have a balanced diet. You just can't eat eating dal or sambar, only one thing, or just chapati or just rice. You need mix of things in your plate to give you a proper nutrition to your body and proper balanced diet. Similarly, exercise are of three kinds which everybody needs to inculcate. The cardiovascular exercise, which means walking, running, cycling, jogging, swimming, anything which increases your heartbeat, and this should be at least 30 minutes every day for at least 5 days a week. This is the minimum prescription. Second is your stretching. So stretching is like movement of your joints, all the joints as we do it in yoga or stretching exercise, which has to be done every day and which can be done even during office hours where you are sitting. Every 1 hour you move one of the joints to and fro. So clockwise, anti-clockwise, the way they are supposed to move, twists and turns. These can be done even during office time without putting extra efforts, but in 10 minutes you can just stretch yourself. And third is your strength training, which should be done at least twice a week. That means strength training means picking up the external weights or using your own body weights to strengthen your chest muscles, the major muscles, the shoulders, the biceps, the thigh muscles. And this is the way normally prescribed. So you have a well balanced of all kind of exercises for yourself. and indulging too much. So I would suggest 1 hour every day is enough for a normal non-athletic, somebody who's not planning, like not wanting to go in a bodybuilding show. I think this is enough to keep yourself fit. But when we say exercise, it should not be at the expense of sleep. And I'll tell you the question which you have asked, that why people have developed heart attack despite exercising. I have gone into those case studies. I have a lot of case studies where people who were considered as exercise freak, diet freak, have died of heart attacks. And when I have dwelled into their lifestyles and tried to find out why did they develop a heart disease, I have found two things. Either they were sleeping less, or they have been under tremendous stress. So when you are not sleeping well, or you are under tremendous stress, there is an inflammatory reaction in the body. And even the minor blockages means severe blockages are one which are more than 70%, which will actually cause symptoms of angina, heaviness of chest and walking, and they come into attention much early. But if a block is 50%, 60%, less than 70%, they do not produce symptoms. But because of the inflammatory activity, they can get ruptured and cause a heart attack. What happens when you get a cut on the skin? The blood oozes out and forms the clot. Similarly, the blockages inside the arteries can get ruptured if they are thin, and they can cause clot formation and cause a complete occlusion of the artery and cause a heart attack. And this is what happens in those healthy gym going people who have been exercising, but they are under tremendous inflammation because of the inadequate sleep and a lot of stress.
Sure, doctor. So thank you so much for giving us not only an overview about the actual comorbidities, but I think you've gone into the complete lifestyle modification and gone into the realms of sleep and stress. And I think our viewers must have found it extremely useful. And I'd like to conclude too by telling our viewers not to take any of these health conditions lightly, because they will be making all the difference between having you manage your heart disease well and going over the line and developing very severe heart disease, which can even impact your survival. And please do consult your doctor for all your clarifications so that you can have enough follow-up care, enough screening. Early diagnosis is important, regular follow-up is important. So please don't take this lightly. So thank you very much to all of you for joining, and do subscribe to our YouTube channel for other updates and other interesting health videos and other information. Do put all your comments, and even if you have any more clarifications or doubt, do put it on the Facebook page and we will get back to you. So till we meet again, stay safe, stay well, stay healthy. Thank you. And thank you, Dr. Rahul Gupta.
Thank you. Thank you, everyone. Thank you.
Namaste.